4-year-old Juliana is back home recovering this morning, but she spent several days here at Beaumont Royal Oak in intensive care getting treatment for this rare diagnosis, which the CDC is still studying. Now, in most cases, when a child gets COVID-19, they either have very mild symptoms or no symptoms at all. And in the case of Juliana, that was the case as well, until then she got sick, very sick. The Okori family was doing everything right, avoiding trips outside their home as much as possible. Mom and dad lucky enough to work remotely, but COVID still made it inside.
So none of us had any symptoms. We were all asymptomatic.
And then last month, their oldest daughter, 4-year-old Juliana, had a low fever, then red lips, a rash, and a urinary tract infection. She ended up in the ICU at Beaumont Royal Oak for several days with something called multi-system inflammatory syndrome.
It was just things you never thought you would be talking about. And, if we just want to get the word out there.
Dr. Jamie Hope, an emergency medicine doctor at Beaumont, says this is a rare but concerning side effect of COVID, making recovery from the virus that much more complicated.
Heart, kidneys, intestines, brain, skin, all of those different things. So we need to look at the child as a bigger picture.
The Michigan Health and Hospital Association is sounding the alarm on the possible long-term impacts of COVID-19 in children. It's reporting pediatric COVID-19 hospital admissions jumped by 237% since February 19th. The CDC says the root cause of multi-system inflammatory syndrome in kids is still unknown. Emergency symptoms of the condition include trouble breathing, pain or pressure in the chest, new confusion, trouble waking up or staying awake, and pale gray or blue-colored skin. If your child exhibits symptoms, you should contact their doctor or bring them to an ER right away.
It's still something that we're trying to digest. We still haven't really comprehended that.
Now, Juliana will have to undergo tests until she's 10 years old to determine whether or not she is, in fact, a COVID long hauler. And this is an example that doctors say it's so important to still go and seek care if you have any kind of a medical emergency. Emergency departments, just like the one here at Beaumont Royal Oak, they are still open right now and they are safe. There are safety protocols in place to make sure you can still get care and also mitigate the spread of COVID-19. More information on our website, WXYZ.com. We're live this morning in Royal Oak. Jen Shantz, 7 Action News.